Good afternoon and good evening to all of you, depending on where you are joining us from. I'm so glad to see such high numbers already just before we started. My name is Patience Dabula, and I'm delighted to be your host, moderating the session today. Please note that the simultaneous language interpretation from English to French and also from English to Portuguese that can be accessed via the interpretation icon at the bottom of your toolbar, depending on the device you are using. Please click on the interpretation icon that's relevant for you, and you can select English, you can select French or Portuguese language based on your preference. Thanks for that. Antimicrobial resistance. I think if we go to AMR 101, antimicrobial resistance is when medication stops working to treat certain germs, either bacteria, virus, fungi, or parasites. It presents a critical challenge to public health with significant threats to human, animal, and environmental health. Antimicrobial resistance, short in AMR, remains a key threat to global economies as it strains health systems, overburdens healthcare resources, and inflates health expenditure, while already causing many challenges and pressures on the existing economies that are already struggling in some of the cases. We also sometimes wonder, how can we then fight something that occurs naturally? Because when it comes to AMR, it's a natural process that happens because over time, antibiotics develop real resistance, but sometimes it's something that is caused by us by overusage and different reasons. Some of the causes for AMR are self-medication, environmental pollution, disinfectants, pesticides, and gene transfer. Those are not the only ones. I think the list is long. However, this is one of the topics that forces us all the time to know that we have to work together as AMR has no boundaries. In today's AMR CoP sessions, I'm excited and glad that we'll be looking at how the environmental dimension of antimicrobial resistance is, and to check really whether we are doing enough or there's still a lot that we can still do. This is a session that will take a total of an hour, including the questions at the end. And we also then want to be sure that we are encouraging you to put your questions in the chat as the speaker is then taking us through this interesting topic. And I'm glad that this is our first environmental one. And it's a privilege to introduce today's presenter, Professor Luther King Abia Akebe, to you. King, as he calls himself, is a professor of applied and environmental microbiologist at the University of KwaZulu-Natal in South Africa. He's also the founder and CEO of the Environmental Research Foundation. His research focuses on, but is not limited to, antimicrobial resistance in the environment and how this relates to human and animals through the One Health approach, using culture and molecular techniques, including metagenomics and whole genome sequencing. He has over 20 years of experience as a microbiologist and is involved in many projects, including monitoring water and soil for human pathogens, especially antibiotic-resistant ones, under changing climates. He has published over 100 journal articles, 6 book chapters, and 4 books. He has also graduated several PhD and MSc students. Prof. King also serves on many local and international committees and panels where he shares his experience of the environmental dimension of AMR. Thank you, Prof. King, for joining us. I'm handing over to you to take us through this presentation, and we're looking forward to hearing from you.
Okay, thank you very much, Patience, for such a flowery introduction. I'm quite humbled to be present in this forum and to share the little knowledge that I have about antimicrobial resistance. I will just go quickly to share up my slides, if you permit. Okay, thank you very much. I go by the name King. It's easier to get it that way. At times, a little bit, people ask me a lot of questions, why Luther King? I don't know the answer. When I meet my father in heaven, I will ask him. But anyway, today I'm not coming in as king of my father. I'm coming in as a microbiologist that likes sharing knowledge and also learning from everybody. And thank you very much, Patience, and your team for organizing this forum. I'm going to be presenting today on environmental dimension of antimicrobial resistance and asking the question if we are actually doing enough. My presentation is just going to be a brief introduction and stories that we already know. The problem with most of our presentations is that we always preach to the saved, but that's fine. So I will go on to some talks on what AMR is and where it places the world today in terms of health aspects and its impact on the sustainable development goals that we are supposed to be meeting very soon, and what are the projections. And I will bring in some questions regarding the environment because my topic goes on, are we doing enough? And I'm going to present a little bit on some works that we did, one of our PhD students did in our lab. I am leading the environmental arm of the Antimicrobial Research Unit at the University of KwaZulu-Natal, headed by Professor Sabia Isaac. So the works that I'm going to be presenting are my views, and some of them are going to be works that we have already published. So do not attribute that to someone who has not been mentioned here. Okay, let's just look at brief history. And there was a time in history, once upon a time, history says that about 2,500 years ago, this guy came out of his shower shouting, "Eureka, Eureka, Eureka. I found it, I found it, I found it." That is over 2,000 years ago. Well, I don't know if he had the time to put on his towel before jumping out of the shower. His children and the wife may have to answer that one, but that is not our business. About 950 years ago, another Eureka moment came into medicine when Sir Alexander Fleming discovered the first antibiotics. This was a Eureka moment for medicine. This was a Eureka moment for the world, because during the wars, a lot of parents could go back to their homes to visit their children, despite all the injuries that they had in the field. Antibiotics were among the biggest discovery of humans' existence at that time, and they could treat a lot of infections. But while the initial Eureka lasts up to more than 2,500 years ago until today, the antibiotic Eureka, just 96 years after, are we still talking about Eureka? Let us look at it. If we look at this brief history of antimicrobial resistance, therefore, and then we look at how the increased use of antibiotics went from 1945, from the creation and the first commercialization, it went straight into massive use in humans, massive use in animals, massive use in the environment. But what was that massive use accompanied by? It was accompanied by a simultaneous rise in antimicrobial resistance immediately 3 years after the first commercialization. That was very, very short-lived. And today, you will agree with me, being in the medical field, you will agree with me that we don't have new classes of antibiotics being developed, and microorganisms have become resistant to almost every single antibiotic that we know out there. So, but then, if we look in terms of figures, how then do we bring antimicrobial resistance compared to previous pandemics? If we look at the major pandemics that we had in the past, we have the Spanish flu, the HIV, and the COVID. Looking at the death tolls, we see that these pandemics caused massive human loss. But where do we situate AMR in here? If we look at 2019 alone, just 2019 alone, we will realize that close to 6 million deaths were either directly or associated to AMR. Now, if we are talking about 6 million in a year, and if we wanted to take the lifespan of the COVID or the HIV or the other pandemics, then we'll realize that AMR is an unparalleled pandemic, which if not addressed properly, then the world is heading to a catastrophic situation. Well, we may be saying that way, and it's difficult to really picture it. But the recent report that we have says that between now, we are in 2025, that's what's interesting. Between now and 2050, it's estimated that close to 208 million people will die of AMR, whether directly or associated. That's 208 million people. The world is 8 billion people or above that. When I say 208 million, somebody might say, what is the fraction in terms of the overall world population? Let us leave it that way. Let us make it a little bit frightening so that we see the amplitude or the strength or the capacity of the AMR. Now, 208 million, let us assume that a Boeing 777 can carry a maximum capacity of 550 people. Now, if we divide 208 million, I was not good at mathematics, please correct me if I'm wrong. If we divide 208 million by 550, we are having about 378.8, if not mistaken, close to 380 Boeing 777 that will crash. Imagine that number of Boeing 777 crashing between now and 2050. If we bring it down further, we will realize that dividing that number by the 25 years we are projecting, then we are going to be having about 15 crashes per year, which means it's more than one crash per month. Now, when we look into it in terms of such plane crashes, knowing that planes transport is very, very safe, then we understand quickly the gravity of what AMR is going to cause. Imagine us getting up every month and hearing that a plane of 555 people has crashed. Now, that is what may happen if measures are not taken quickly. Now, this therefore says that the next 5 years, which is the time we have for meeting the Sustainable Development Goals, are highly impacted, because if we look in terms of no poverty, we'll realize that already a huge percentage, over 7%, more than 7% of work days are being lost already because people are taking leave. If we take in Sweden, for example, people are taking leave because they are sick due to AMR-related infections. That is already bringing down the productivity. And if we see that it's bringing down productivity, then a sick person cannot be working. We can't have decent work growth, and we can't have innovation. If we go back to hunger, we see that the resistant bacteria are also bringing in food security. We see what is happening with the production industry, the animal production industry, for example. There is a big problem related to AMR. There is a big problem with soil infertility related to AMR. And all those ones, if we say a hungry stomach cannot work, a hungry stomach is a sick stomach, then we can't have decent work, we can't have good health, we can't have quality education. If we go, the list will go on and on. Maternal and child health has been jeopardized seriously. The progress that had been done for the past 15 years is being just destroyed completely by AMR. And if we look communicable disease, we look sexually transmitted infections, we go, the list can go on and on. Even in terms of non-communicable diseases, we look at surgery, we will realize that even surgery is becoming complicated today because of the risk of patients dying from antimicrobial resistant infections due to resistant organisms. And if we look at the case of treating TB, for example, look at the figures there. That's close to $500,000 to treat a case of extremely drug-resistant tuberculosis. And if we bring that down to low and middle-income countries, let's take the case of South Africa with a very high rate of HIV, and Swaziland, for example. And if we take the cases of TB within these places and we translate those number of cases and the number of the increased number of extremely drug-resistant TB, we can see what this is going to cost to the GDP of those countries if they were to have just about 10 to 20 of such cases in given time. Therefore, AMR is affecting I mean, every single sustainable development goal. Are we going to meet these goals in the next 5 years? Go back to the environment is the same thing, and therefore, it's being advocated then that if we are going to win in this battle, first, we need to move from word to action, and that action starts by implementing correct and efficient communication between the animal, the human, and the environmental health sectors. Only effective communication between these three sectors in terms of what we see regarding AMR will bring out that real interconnection so that we can get possible solutions. However, despite the advocating for the One Health, human health is great. There is massive improvement. We know the aware list from the World Health Organization. We are controlling that so well, and it is going. In some cases, we can see that it's dropping. If we look at animal health, South Africa, for example, has removed, and many other countries in the West have removed the use of antibiotics in animal farming, for example. South Africa is also in that process of doing the same thing. But are we doing the same thing for the environment? And the answer is no. The recent UNGA still advocated and on the One Health and brought in the political declaration on AMR, and which brought the importance of the environment in terms of AMR. So therefore, what we need to understand when we come to the environmental aspect of AMR is that AMR is not an artificial thing. It's a natural process. I'm here sitting now. If somebody was to make a lot of noise, I will have options. I'll definitely probably get some earplugs for my ears. I will shut my doors. If my neighbor continues to make noise, I might call the police. I might put sound wall proofs. I will look for a way to fight that noise as long as I want to be comfortable in my environment. Now, microorganisms have been existing since the creation of time, and they have been existing together. Bacteria have been living with fungi in the same environment. Before Alexander Fleming even discovered the antibiotic, the penicillin, bacteria were already exposed to that. So they were also fighting that mechanism already in order to survive in that same environment. And in trying to fight that, they developed resistance mechanisms. But the problem here is that human health, therefore, amplifies the problem. Human and animal health components amplify the use of antibiotics, the excessive and indiscriminate use of antimicrobials in the sectors or by humans. That is what amplifies the problem, because most of the antibiotics that we take in our body, a huge percentage, some studies even say up to 70% of them go back into the environment, either metabolized or not metabolized, unmetabolized at all. These antibiotics are still somehow active, not enough to kill the microorganisms, but to irritate them. Now, remember, if you go back to the noise I was saying, the organisms want to survive. It's survival of the fittest. They want to survive. So these pharmaceuticals irritate them, and therefore, in that environment, they need to survive. And they develop mechanisms to resist that. Not only, we should also know that it's not only antibiotics that have been involved in triggering antimicrobial resistance, although we talk a lot about antibiotics, but heavy metals also have the potential to amplify antimicrobial resistance in the environment. Even in animal production, when we use some of the food additives, let's take zinc, bacitracin, for example. Zinc has been shown to trigger antimicrobial resistance. We take copper, for example, that is in some of our detergents and some of our body sprays, and those things, all our silver, they trigger antimicrobial resistance. And all those chemicals are usually discharged in the environment in massive quantities. The same thing goes to biocides. And if we therefore look at it, we decided to conduct a study here in KwaZulu-Natal. This was done by Dr. Chuku. He obtained his PhD. We did this study here where we decided, therefore, to check for the presence and concentrations of selected antibiotics, I beg your pardon, heavy metals and biocides in wastewater treatment plants and their receiving waters, to find out if the limits that were there were above the predicted no effect concentrations, meaning that below that concentration, we should be fine. Above that concentration, there should be a problem. So because above that concentration, it is anticipated that such concentration will be able to trigger selective pressure and cause antibiotic resistance. What did we find? We sampled around this area where you see mapped, that's the Davie wastewater treatment plant, which is found in the Umgungundlovu district, one of the biggest districts here in KwaZulu-Natal. And we collected water from upstream, downstream. What I want us to see is we found 13 different antibiotics at different concentrations, 38 metals at different concentrations, and 7 biocides. And these, most of them, some of them were above the predicted no effect concentration. Then what we said, therefore, we say, okay, if it is said that these concentrations above the P-neg value would probably be a problem to trigger antimicrobial resistance in the environment, then let us see what happens if we expose previously susceptible microorganisms to these concentrations within the lab. So what we did is we exposed our E. coli, known strain E. coli that we tested, first of all, sent for whole genome sequencing, ensured that this organism had no resistant genes in it. And we exposed it for 30 days to different concentrations which we had seen in the environment, to environmental concentrations of our biocides, our heavy metals, and our antibiotics. First singly, and then as a combination. And what did we see? Just as the title says, we realized that fully susceptible E. coli was used. And after exposure, we checked our organisms to 19 antibiotics used for human health. Then we sent our organisms for whole genome sequencing to see if after exposure, this organism had developed resistance. And at the same time, when we were isolating, when we were detecting the metals and all the other pollutants in the environment, we also isolated E. coli from that same environment. So when sending our experiment and our lab isolates to sequencing for whole genome sequencing, we also sent our environmental isolates so that we could compare them. What did we find? Don't look a lot about the image, but what we realized is that the environmental isolate had so many resistant genes in different combinations and permutations from almost all the other antibiotic classes. These are our environmental organisms. However, our lab organisms did not show any presence of antimicrobial resistance phenotypically and genotypically. So we therefore said, okay, this was a little bit strange. So we decided to do single nucleotide variant calling, and we found 258 variants, about different variants from this that projected to about 19 genes in this case. What this means is that these organisms had the potential, after exposure, they did not become resistant, but they suddenly developed the potential of mutation to resistant isolate. So we therefore checked the impact of the environmental concentration on the mutant selection window. This is the window that will allow, above which only mutants will continue growing while susceptible organisms will die. To cut the story short, what we saw is that the mutant selection window increased for antibiotics. If we look here on our mutant prevention concentration, we see that compared to the control, we realize that it increased, meaning that our control could be eliminated, but our organisms had developed the potential to survive in the presence of those antibiotics. The same thing applied with the zinc and then with BAC. And we also had the whole same mixture, the same situation occurring when we combine. What this therefore meant is that our organism had developed tolerance. And tolerance is that precursor to antimicrobial resistance. But what surprised us was the fact that within 30 days, at those concentrations which are above the PNEG, we were expecting to see resistance occurring, because previous studies have either used unrealistic concentrations excessively high at like concentrations that we wouldn't normally see in the environment. But here we used environmental concentrations, and what we saw is our organisms were developing tolerance rather than antimicrobial resistance. But again, tolerance is a precursor already to that. So no stressors. Not all the stressors identified were investigated. This is a shortcoming. We should understand that we had selected antibiotics, we had selected metals, and we had selected biocides. We did not detect all of them. And the environment is not a static one, especially the aquatic environment. The soil could be a little bit static, but the aquatic environment floats, so it's not static. So what we need to understand is the environmental concentrations that we used and the settings, the laboratory setting that we had was trying to mimic the environment, but not up to the environment. So other aspects like temperature, pH, suspended particles, and whatever, water flow and everything that happens in the environment were not taken into consideration, which brings a shortcomings, the same as in our study, brings a shortcoming to almost all the environmental studies that are conducted and that report on the development of resistance in the environment. But then, do we therefore continue saying that humans are the problem when we look at the spread and the rapid spread of AMR? Do we continue saying that humans are the problems? Let's look at this, what the World Health Organization say here. I'm going to read it for word. They say, many people think that AMR is primarily caused by overuse of antimicrobial drugs, but environmental factors may cause the spread of AMR even more than the use of antimicrobials, especially in developing nations with limited access to clean water, poor sanitation, and rudimentary waste management. This short sentence here says it all on the role of the environment. Despite this, we still don't have all the necessary information that we need to project. For example, the AMR that has been reported and the number of people that will die, we look at it in terms of animals' health and human health. We look at it in terms of infectious diseases. We look at it in terms of how many people are hospitalized. So we can quantify the numbers in that case. But when we look at the environment, here we stand. This is a picture of the environment. When we look at it the way it is, where do we start fighting? Is it in the air? Is it in droplets of water? Is it in the plants? Is it in the soil? Is it in the ocean? Or that interconnection, is it in wildlife? Where do we start placing those figures? Where do we start quantifying the economic impact of the environment on the spread of AMR and its implication on the spread of AMR and human health? This places us here. I'm not sure where many people will place themselves here, but I stand where I am puzzled, I am unsure, I am confused on where to start. I am lost most times when I look at the environment. I'm baffled at how much the environment plays, and it's still unclear because this image itself, understanding it is not the simplest of things. And also, we realize that the environmental dimension of AMR, therefore, needs more studies to inform the direction towards effective integration in the One Health. Just like our brother standing there, if we consider each of those sticks as the three arms of the One Health, No one stick can stand, but if we place those 3 sticks together, then we are able to carry big weights. Because that is what is needed. And if that is needed, then the environmental component needs more attention. When we look, therefore, again, even in the environment where we have done studies on the environment, most times when we do studies in the river, we will look at the river water, we look at the lake surface water. How many times do we look for AMR in the bottom sediments? There are studies that I had done previously in, I think, 2016, where I showed that there were more resistant bacteria in the sediments than in the water column. And in a resource-poor setting where people get into, or resource-limited setting where people get into the water, trample on the water, I still showed that trampling on that water increased the risk of infection from about 30% to 100% if people were to be exposed to those water. And therefore, we don't even investigate the sediments. How many times do we do investigations on the marine? If you have the time, just try to check how many droplets or how many aerosols are generated when we have waves. And then if we check also what is the microbial load of the marine environment, then we will understand how many aerosols are generated containing microorganisms and containing AMR. Do we check that? Do we check the quality of air? Do we check AMR in air? Very few studies are actually doing that. And therefore, we need more studies that will mimic the environment, studies that will replicate the environment to the closest, so that we can understand, do these organisms come inside there already resistant, or do they develop resistance within that environment? And if they develop resistance within that environment, what needs to be done? What needs to be done? While those studies are going on, we need to prevent the introduction. Remember, I said AMR is natural, but the indiscriminate use and the excessive discharge of these pharmaceuticals and pollutants in the environment amplifies the problem. So we need to reduce that already, such that we can now focus to understand how things are going on. These are some of the references that I used, including the ones that I put on the paper. And these are the team of the people. Kelechi was a student who worked on it. Dr. Amwako and the others are all collaborators. And I want to acknowledge the University of KwaZulu-Natal. Oh, I forgot to, I had my ASLM logo there and it disappeared. And ASLM for organizing this and the funders. Thank you very much for your kind attention. I will be willing to take in questions.
Wow. Thank you very much, Prof. That's really exciting. And I see then, I think even in the chat, that the people that are listening are also then impressed by what you are sharing with us. We appreciate your presentation and thanks for teaching us about the environmental dimensions of AMR. I think, I'm not sure whether you answered your own question. Are we doing enough? I guess the question.
Yeah. Sorry, I am stopping the sharing so that I can go into the chat easily.
Yes. So then I think that then one of the things that I also then think of is, maybe are we doing our best, even if it's not enough? That always becomes a challenge to us. In your presentation, you highlighted how antibiotics are good for us. I think that is not debatable. However, you gave us the history. At the end of the day, you managed to scare some of us with the numbers that shows the number of deaths from 2025 to 2050. I think years ago, when you say deaths estimated from 2025, yes, we knew it's coming. Now we are in 2025. Now the reality is more as well. So I think your talk also keeps on highlighting that AMR is an integral part of sustainability development goals. And that's for all of us and everywhere else. The solutions keeps on confirming that One Health is the way to go. We cannot do something different, and there's no sector that can work independently to combat AMR. And as you highlight that sometimes we as humans are the problems, you also showed us at the same time that the environment is a complex place. It's not as easy as humans or animals, and it's always uncontrollable and difficult then to deal with. We have some questions in the chat that I'm going then to go through them, but I also must indicate that there are many comments that have been complimenting your presentation and saying that it's good. So there's a question then from Jeremiah that says, do you foresee an increased AMR as the world adopts telemedicine? If yes, so what could be the solution to that?
Thank you for that question. Telemedicine is one of the things that really fascinates me. I like it now. You know, with that approach, we are able to reach so many people in many places and all. However, there is a truth. There is a truth. We live in a society where we have built so much on industrialization. And if we look again, and I did mention that it's not just the antibiotics. We can control that, right? But how many industries are still getting into the use of heavy metals? How many industries are still discharging that in the environment? Now, we have pulled some of the things out. Take our toothpaste, for example. We used to have triclosan. We knew it was all that good, but later on to realize that it was a problem. So as the time goes, it's difficult to predict that it will reduce. It's difficult. Honestly, I wish I could say that, but the hope is that with telemedicine, informed treatment will be taken care of. But remember, again, informed treatment, again, telemedicine focuses again on human health. We still have the animal component, and we still have the environmental component. In the animal component, we need to improve biosecurity. But when you go to a farmer, you come to a local farmer that has his pigs, you need to convince him or her that by taking out the antibiotics from the animal food, you are giving them an alternative to still make them gain without losing their animals. So there is that whole complex aspect. Is telemedicine also going to address that aspect? Human medicine, for example, if we go by that, we may say, okay, we shouldn't use tetracycline, or we shouldn't use ciprofloxacin, as we are seeing increased resistance to ciprofloxacin, especially in urinary tract infections and things. But we prevent that. So we think we have solved the problem. But in animals, there is oxytetracycline that is used. There is, or is it ofloxacin that is used? They have the same mechanism of action as those that are used in human. So we may be solving the reducing that aspect, but if we do not take it also there on the human aspect, on the animal aspect, and also on the environmental aspect in terms of what we use in terms of chemicals in our environment, the work in the human field is going to be futile. That is why we call upon that whole integration of the One Health. Telemedicine is awesome. If we had just the human component, then we can say yes, it will definitely. But with the other components, we need to see how to integrate something similar to the other components so that we can actually work on that. I don't know if that answers your question, but that is my point of view.
I think we appreciate your point of view as well on this one. There's an anonymous attendee who says, has there been many studies on antimicrobial resistance in the environment among the street reclaimers in Africa been done over the past 5 years?
Sorry?
Has there been many studies on AMR in the environment in Africa over the last 5 years?
They are limited. They are limited for certain reasons. I published a paper in 2022 where I'm talking just on wastewater, for example. I'm talking about the African wastewater resistome and identifying knowledge gap and future perspective. So I'm trying to, there in that paper, I was doing an analysis of the works that were done, that have been done in Africa over the years. And if we look in that study, we'll realize that out of the over 54 countries that we have, just about 13 countries had studies. And of those 13 countries, at times they just had one study that was conducted. And the problem being that most times the people who go to do environmental studies either do it by chance They were not targeting AMR, they were doing something else, and then the components of AMR came in, or they do it because we don't, okay, take human health, for example. We have standard protocols on how to do 1, 2, 3. In the environment, we do not have such standardized protocols. So reporting even becomes so difficult. And considering that Africa contributes just less than 1% of scientific research, it's but evident that finding these studies are usually difficult. But what I noticed is that from 2000 and we're in 2020, from 2012, 2013, the number of studies in the environment have been increasing. They are actually increasing in Africa. True, they are. The other aspect is that funding for these studies are quite challenging.
Yeah.
I have attended so many fora. I've been to so many conferences, and most times the funders want to give money for human health. They want to give money for animal health. When we talk about the environment, they tell us that we should create models that can predict about this behavior. You can't predict how a microorganism will behave in a river when you drop it. You can't. You can't predict them. When we see an environment, let's say a river, we have microenvironments within that environment. We have different, because of the presence of the chemicals, there's the whole chemotatic reaction, and microorganisms move left, they come, they are trapped. So it's a whole complex thing. The only way we can do that is do the same approach we did with humans. We monitored humans until we had things that we are sure of. If we monitor the environment if we really monitor the environment, we will get to the point of saturation where we feel like the outcome we are getting is not different from what we have been getting. And we are able then to tell. But when we propose monitoring studies, for example, they say that's basic. Especially with the coming of AI now, it's even going to be worse. So funding has made it quite challenging, but we believe that because of the new political declaration, a lot of governments are going to put that in their national action plans. Again, another thing which is completely lacking in many African countries. And even the few action plans that exist, if you look at them, they don't have the environment really incorporated in that. So it's not a priority. It's just not a priority. You see, so the studies are there, but a little bit scattered.
Thanks for that. I think even to the audience or those attending, it's easier. And now you know if you want to publish, where to go. You know if you want to go to do more research, where do you go, because the studies are few. And I guess that much as we claim all the time to be saying that we are working on One Health, we cannot then ignore the environment. And especially when as funders are then coming through and funding AMR and understanding that we don't have an option of ignoring whether the animals or the environment. I think there are motivations to look at that, because at the end of the day, the environment affects all of us. There's a question from Eugene Mubanga, who says, which stressors had the highest mutation at the lowest concentration? I think they're referring to one of your slides.
Which stressors had the highest?
Yes, mutation at the lowest concentration, if you remember that one.
Yeah, there we didn't do at the lowest concentration. All of them had, okay, we can't compare those stressors per se, as I'm saying. Where we saw the highest thing, we mostly saw that with the antibiotics, though. And if we look in the list, it's because we tested more antibiotics. So we tested more antibiotics. We tested just 3 biocides. Metals, we tested just 2. So you see that even in our design already, we kind of biased it. So it's very easy to say, okay, the antibiotics had more. If we had probably exposed maybe the metals, the microorganisms to the metals at the same, in the same level or the same quantity, probably we could have seen something that is different. And those are some of the things that I say, we get limited at times by the funding that we have to carry out the studies, or we get limited by not having standards and just going in there and trying to understand. And this study that we did has already stimulated other studies which other PhD students are working on now to see more on the effects of that. So getting that comparison at face value, we'll say the antibiotics. But again, the numbers that were compared would definitely skew our thinking.
Okay. Thanks, Prof. Then Samuel Cherry Lightbed says, what are the potential environment impacts of antimicrobial resistance, and how do wastewater treatment plants play a role in the spread of resistant bacteria?
Okay. Let me start from the bottom, from the back, from the front, the back with the wastewater treatment plants. Yes. Wastewater treatment plants they are known. The error that we commit at times is we think that wastewater treatment plants are meant to purify water and remove everything. No, they purify the water to acceptable limits that can be discharged into the environment, assuming that within that environment, there will be a dilution factor that will occur. The environment most times in this case is either the ocean or the river surface waters. So there will be a dilution effect. And by the time the drinking water or other water system are taken from there to treat to send back in our homes, they have less to deal with. However, we should also know that wastewater treatment plants were never designed to remove genes, for example. When the microorganisms die, their genes are still present in the environment. And there are 3 different mechanisms in which these genes can be transferred from one place to another. Without being a little bit offensive, microorganisms in the environment are like a beautiful woman passing in front of a beautiful shop with beautiful necklaces. When they see a piece of jewelry, they want to pick it up, right? So organisms in the environment just see beautiful strands of DNA strolling around through a process called transformation. They pick that and integrate it in their system. And by picking that, they pick resistance. These genes are not eliminated by wastewater treatment plants. Also, wastewater treatment plants were not designed to remove chemicals and emerging contaminants. Improvement is going on now in many of the places to ensure that this happens, but they discharge so much of this, that huge quantities of these antibiotics, the heavy metals and the biocides in the environment, which become stressors inside there. So when we now, after having put that inside there, if we go to the impact that it now has on human health, that is what we need to quantify. However, I did some studies again, I think 2015 or 2015, 2016, where I was looking at the quantitative microbial risk assessment of pathogens in water in rural settings and comparing to see what was the risk of infection. Now, it's easy to look at what percentage of microorganisms we get now in our total population that are acquiring resistance. And if we say these people will be ingesting this volume of water containing this percentage of microorganisms, we will realize that there is a very high impact. And quantitative microbial risk assessment of antimicrobial resistant organism is going on now in many places. They're even using genomic data now to try to quantify that risk. But there is a risk of infection, especially in low and middle income countries. And we shouldn't also feel that we are safe when we are in the cities, because we have studies done in South Africa that picked antiretrovirals in tap water. So if we can pick antiretrovirals in tap water, the same thing in some other places. And if we are consuming water loaded, I saw there is I don't have that picture, I would have posted it. I saw a picture on the internet where somebody was drinking water from the tap, but it was full of antibiotics. It was, I think, in an Asian country, it was full of antibiotics. But when you drink that, what does that do in your system? You're treating yourself again an infection that you don't have. And that also causes that. So apart from exposing ourselves from the resistant microorganisms, we are also exposing ourselves to chemicals that can push that resistance within our body. So measuring that impact of the environment on humans is what we are still looking at. And that's why I was calling for, I think during one of my meetings, I was saying, it's easy to say the AMR, like O'Neill's report, for example. O'Neill said, if nothing is done, AMR is going to be costing about $100 trillion on global economy. But that's based on human health. Can we also generate that in terms of figures? When I gave in terms of the number of people that would die, and I brought it in terms of how many Boeing 777 that can translate, we said like 15 Boeing 777 dying every year. That is how much the impact of AMR is on humans. So thank you. I don't know if I get your question clearly on that, but or if I answered it correctly, but the impact is huge.
Yeah, Prof, I guess that all the time, the impact is huge. And I think as you are answering now, I keep on thinking, yeah, the environmental topics are also interesting, but at the same time scary, because you are practical and showing us examples of things that we do. And I'm thinking now, okay, am I going to the tap or what after what you just said? Of which the reality is that this is how serious AMR is. It's part of our day-to-day living. Everything that we do then is affected. And that is one of the reasons why we should consider then and always be mindful of what we are doing on a day-to-day basis. There's another question. I think we still have a few minutes. I'm going to wrap up soon, and I had said that we are not going to be able to cover all the questions, and we will discuss with Prof how to deal with that and share later the answers. But for now, there's a question from Guy Arnold Rock, Fombi Ibinda, saying, thank you. Please, by which mechanism metals like zinc increase the development of resistance?
Okay. What we found with most studies is that usually within the genetic material of, let me go back to simple, within the genetic material of the organisms, the genes that are responsible for resistance to metals at times are found within the same genetic compartment or next in the same genetic environment with genes that are responsible for antimicrobial resistance. At times, they are carried within the same plasmid. So although the organisms did not intend to resist the antibiotic, its intention was to resist metals. But the same gene that is responsible for that is the same that goes in for the thing. Now, if we take, let's take the gene, the ones for multi-drug resistance, the efflux pumps, right? The efflux pumps don't select what they send out. But maybe they were there because of some heavily polluted metal environment. Then antibiotics come and they push out everything. They are not selective to what they are sending out. So that genetic environment plays a very important role. These genes, that's why we say the genes at times are the same. I think there is I can't remember the gene, but the gene that is responsible for copper was also found to be linked to almost to the gene that is responsible for resistance to ciprofloxacin. So that link is there. It's right up at the genetic level. At times it's unintentional. Most times.
Yeah, I guess it's survival as well from the organism side. Maybe the last question before we get to the comments and give you a chance just to wrap up is then from Ritu Mukari Chauke, who said, I'm not a clinician, but curious to know how AMR related deaths, both direct and indirectly, is determined. How AMR related death, both directly or indirectly, is determined. How do you then determine this death is caused by AMR?
Well, that's an epidemiological question, and I'm sure the epidemiologists up there would probably know. But I think hospitals have systems that keep down record of causes of death. So if we look at direct cases, we are talking about cases where the person is known to have died. Let's take respiratory tract infections, for example, lower respiratory tract infections that are, I think, the second leading now in terms of, it's very easy to say that this person died of this infection and this organism was found to be resistant against 1, 2, 3, because these are things that are being tested now within. So those direct ones can be linked. Now, there are other indirect cases, like in terms of surgery, for example. I mentioned that surgery is becoming complicated because somebody comes in for a non-communicable disease, gets surgery, and in that process, maybe has one of the medical like the urinary catheter, for example, and that is loaded with hypervirulence, Klebsiella pneumoniae that is resistant. So you see, the primary cause is not the bacterium. It is something else. It is a surgery. It is the insertion of a device, but the bacteria come in as secondary. So I think epidemiologically, they have a way of determining this thing, which is really not my field, but that's the way I usually look at it and I think about it, and which just makes logic to me to see how these figures come up.
Yeah, I guess that your answer also says to us that we still have a lot to learn about AMR. And with all the numbers that we see on how it affects us on a day-to-day basis, the link is always a challenge for us, because we just think that when an organism is resistant is something different, while at the end of the day, we are then affected. And having mentioned hospitals, that reminds me of areas like nosocomial infections as well. Sometimes you go in, well, you are treated for something else, and at the end of the day, you end up being exposed as well, or acquiring some hospital infections that also then would cause a problem. Going back to what you were saying, that the environment is always a challenge, and the environment is not limited to one area for us then to look at and change and also consider going. I guess this is one of the most interesting topics, and we will continue as an AMR team to try and look for topics that are interesting for other people. Prof, just from your side, are there closing remarks quickly from you based on what the questions have been coming and some that will still be coming to you from your side?
Okay, thank you. I just want to say that the numbers are scary, but we don't have to be scared. We are surviving, and I think we are stronger. We are stronger. And when we look at the environment, we shouldn't look at the environment as just water, soil, air. The environment is everything. Just as my students did some work recently in a canteen where they swapped tables, other students did work where they swapped hospital stands, doors, and everything. And we are seeing microorganisms everywhere. When we understand that microorganisms are ubiquitous, they are everywhere, known to man, then we start understanding the impact of our actions, knowing that if the normal ones are there, then the resistant ones can be there. And we should also not forget that most times when we are looking at infections or resistant organisms, we are looking at the ones that cause diseases. We are not looking at commensals, but they also carry resistance, and they can transfer that to disease-causing organisms. So there is much to be done, but while that is being done, we just need to play our role to cut down on that, by following up with antimicrobial stewardship, which I know is taking place in many places, in many countries and many laboratory settings and all. Yeah, AMR is real. It's not going anywhere, by the way. Yeah, thank you very much for the opportunity. And my email was somewhere at the end there. You can send me an email, and then maybe through Patience, you will coordinate, and the remaining questions, I'll be very welcome to answer your questions anytime.
Thank you very much. And once again, I apologize to all of you who have posed questions and we were not able to get to them. Prof has volunteered, and we will share the questions with him so that he will then be able to respond to them, and that will be shared the normal way through the ASLM, then various platforms that we do. Thanks once more, Prof King. And I'm glad that most of you have acted on and responded to the survey. And I want to remind all of you to take ASLM membership if you haven't registered as well. And we will then continue sharing sessions like this. Thank you very much, Prof. Thank you, everyone who stayed with us until this time. We appreciate your time. We know that you are busy and you chose to be with us this afternoon or this morning, this evening for you, depending on where you are. And to the interpreters, thank you very much for the good work that you are doing to ensure that we cover a wider population from all over the world. And to our IT system, thank you very much. And also my co-panelists that have been assisting us in the background, thank you very much. And it's a wrap. Goodbye. Thanks, everyone. Enjoy the rest of your day.
Bye-bye.
Yes, bye.